Hello. Hi, I'm Darrell Gambrell. I'm a nurse practitioner student. I'm going to be going over your medication that I prescribed for you. The medication is called bupropion. And what is it prescribed for? It's for major depressive disorder, or when you're feeling down, have no energy, trouble focusing, feeling worthless, etc. We kind of talked about this a little bit earlier. The benefit of the medication is it will treat your depression by reducing or eliminating its symptoms. Bupropion will improve slow thinking, reduces sleepiness, tiredness, trouble focusing from depression. All right. Some of the risks are some patients may only have a partial relief of symptoms of depression. Um, it can activate bipolar disorder, suicidal ideation, um, Also, it's possible to combine this medication with another medication called SSRIs or selective serotonin reuptake inhibitors, and that can make the medication more effective. Um, that's not always necessary, though. Some of the side effects of bupropion include insomnia, trouble sleeping, tremors, agitation, headaches, dizziness, dry mouth, constipation, nausea, anorexia, sweating, can worsen a motor tic if it's present. Many of these side effects are immediate but will go away with time. So the best thing to do is just wait out the side effects. If the side effects are intolerable, then switching to another drug could be a possibility. Um, More serious side effects include hypertension or high blood pressure, weight loss, anorexia, myalgia, abdominal pain, or tinnitus. Life-threatening or dangerous side effects include, although they're rare, um, seizures, anaphylaxis, Stevens-Johnson syndrome, hypomania, induction of mania, suicidality with antidepressants. Overdose is rarely lethal, but it can lead to seizures, cardiac or heart problems, hallucinations, loss of consciousness, could occur in that instance of an overdose. So, how does this medication work? So, the mechanism of action is the medications give you a boost of chemicals, dopamine and norepinephrine. They are neurotransmitters in the brain. Um, and this medication works by blocking their reabsorption. This makes more neurotransmitters available for your brain to use, improving your mood and energy. Bupropion usually takes about 2 to 4 weeks to see a relief of depressive symptoms. If the medication does not relieve symptoms of depression in 6 to 8 weeks, then the dose may need to be increased or the medication may not work at all for you. Bupropion can be taken for many years to prevent recurrence of depressive symptoms. Dosing instructions. We should get a baseline blood pressure for you today to make sure your blood pressure will not get too high on this medication. We'll ensure also make sure you take the medication no later than mid-afternoon to avoid trouble sleeping or insomnia. Food does not affect the absorption into the body, so you can go ahead and eat or not eat, and you can take the medication. You will take bupropion sustained release by starting 100 milligrams twice a day for 3 days, then increasing to 150 milligrams twice a day. Then we'll wait at least 4 more weeks to see if any adjustment of the medication is needed. Um, uh, when to contact? When should you call me if a problem arises? Please feel free to call me if you're feeling hyperactive for no reason. Your throat swells or you have trouble breathing. You develop a really bad skin rash where your skin kind of breaks open. Or you have thoughts of suicide or suicidal ideation, anything like that, please give me a call. If you have any questions, I'm going to give you this handout. Everything that we just covered will be on there. And, and that's it. And I'll give you the number to our office, and I will talk to you in at least 4 weeks. All right. Thank you. Bye bye.